Welcome to Payment Matters. I'm your host, Jeff Lin. Thanks for tuning in. On this show, we talk about the ever-changing landscape of healthcare payments and the impacts to healthcare payers, providers, and consumers. You can follow the conversation on Twitter at hashtag Payment Matters and follow me at Jeff B. Lin. My guest for today's episode is Matt Seefeld, EVP at MedEvolve and founder of My Lifelink. Matt Seefeld brings 20 years of management consulting experience in the healthcare industry. He has extensive expertise in the assessment, design, and implementation of process improvement programs and technology development across the entire revenue cycle. Thank you for coming and joining us today, Matt.
Thanks for having me, Jeff. I appreciate it.
Can you tell us a little bit about yourself and your background and your experience?
Yeah, absolutely. I always make the joke that I graduated college. I started in healthcare revenue cycle, and 21 years later, I'm still here. So it's been an interesting career for me. I've done a lot in the advisory consulting side. That's where I began my career. Early on, I started to understand the importance of automation and real-time transparency into revenue cycle shortfalls, which I then carried through the last really 15 years. I built my own analytics workflow automation company, Interpoint, which was eventually sold to Streamline Health in 2011. And I'm here at MedEvolve. I've been responsible for kind of restructuring and turning around the business by focusing on technology that is going to drive reduction in labor cost and improve that net revenue, all of which matters when it comes to payments and margin. So lots of interesting things. I do love this industry. I get really frustrated in the industry, but I think that's why I love it, is I continue to have the opportunity to push the needle on technology and automation and try to tell that story of effectiveness in seconds, not months and months, which at this day and age, there's too many other pitfalls in healthcare. You can't be writing off any penny that you could have collected.
Can you tell us a little bit about your role at MedEvolve and what exactly does MedEvolve do?
Yeah, absolutely. Yeah, MedEvolve is a privately owned company founded by a couple of orthopedic surgeons, been around for over 20 years. Really, it started out as a practice management company selling to very small independent physician groups, surgical specialties mainly. And early on, had a lot of physicians asked to offload their billing, so they created an RCM insurance company, and that's really how they went for many, many, many years. When I came on board about 5 years ago, I saw that we're in a commodity space and we've got a lot of competition and with a lot more marketing budget and money than we do, and we didn't have an EMR. So instead of trying to compete in that space, we really had to pivot the business, which is where I came in. I took over revenue cycle, turned it around mainly by building workflow automation technology and analytics technology that could get our net collection rate up to where it needed to be for our clients. And then also making sure that our labor force was not just productive, but effective. And so being able to reduce that labor expense and our margin came back relatively quickly. I built a data science team, so I oversee all of our data science analytics. I call them my smart guys and girls. And then I've got all of our sales and business development, marketing, in addition to the revenue cycle service. A few hats I wear, but I enjoy what I do, and it's nice working for a smaller business where we can make our own decisions and we're not being dictated by venture capital or private equity.
So when you talk about healthcare revenue cycle, what kind of issues do you see? What are the challenges? And I'd love to understand here, like, what's changed also over the last 10, 15 years from your perspective?
Yeah, it's ironic and funny at the same time that the same problems I started to learn about early in my career as a consultant are the same problems that we see. And when people ask me, like, what's the biggest challenge in revenue cycle, I say it's access to intelligence. And really, it's access to effective intelligence, or what I call EIQ. And, when you ask a revenue cycle leader, where are you leaving money on the table? They don't know the answer, and they have to go try to find it. And that can take a lot of reports. It can take a lot of pivot tables. It can take a lot of time. And you can't move like that anymore, right? It has to be brought to you. It has to be, your story of revenue cycle performance needs to be delivered to you in an automated way. So you spend your time actually designing action plans and implementing change and getting results. Same thing with employees, Jeff. I mean, I sit there and I say, well, how many employees do you have? Well, I have 50. Okay, are they effective? And they're like, well, wait, what do you mean? I said, well, they may be productive, but are they effective? Like, are they actually getting the financial outcome you expect for the money you're paying them? Nobody can answer that question because PM systems and patient accounting systems they don't capture all the structured data necessary to tell that story, which is where workflow automation comes in, what we've developed to augment the billing system. And so access to intelligence continues to be the number one thing that I think healthcare is suffering with on the revenue cycle side. And it's really, really around effectiveness of the overall revenue cycle, what areas are in good standing, which aren't, and employees. And we're going to talk, I know, later about some of the staffing challenges, but now this day and age, you have to have this effective intelligence. Quotient is what we call it, because you can't run your business effectively. And the last thing I want to see is private practices having to sell to private equity or sell to the hospital because they feel like there's no hope in maintaining independence.
So you talk about this intelligence and the workflow tied to that, and I've heard some other providers say that's too onerous, that's too burdensome in terms of actually trying to measure this. And asking the question that you highlighted, like, is your team effective? How do you reconcile sort of the burdens of data collection, data analysis versus the ROI and the value that's created by collecting that data?
Great question. Look, every provider that's listening has the right to their data. I don't care if you're a health system, an academic medical center, an IDN, or a small orthopedic group in Missouri. You have the right to the structured data for the systems that you pay for, right? And obviously, patient accounting, practice management would be a big one, EMR, and then other ancillaries. And so I make sure clients understand that building a data warehouse is no longer a nice to have. Like every provider group out there needs to have a centralized data warehouse of which you can plug in workflow automation and analytics technologies to start telling that story of effectiveness, right? Because it's just data, it's structured data. The problem is that 20 years ago, everyone was talking about big data. Then it was everyone's talking about business intelligence. Then it was, well, I have access to key performance. None of that means you have intelligence. You may have data and reporting, but you don't have intel. Intel is when in less than 2 minutes over a cup of coffee, I can tell you how effective your revenue cycle is and how effective your people are and what to do about it. That's intelligence. And frankly, at MedEvolve, I'm trying to push that to 3 seconds. I want a mobile text to tell me that. I don't even want to get out of bed and I want to know this. All right. And that's the level that we're trying to push here at MedEvolve for our clients, but also our revenue cycle services, right? Making sure that we are as lean, as effective as possible when we take on receivable or any revenue cycle function for any of our clients. So data warehousing, tapping into that data, not being held hostage, by your PMEMR, all those have to be addressed. But then you need the intel on top of it. And most companies in our space aren't even thinking about this whole effective. Actually, none of them, in my opinion, are thinking about this whole concept of effective intelligence. They're still focused on, well, I have the reporting for you here. Go click here. It's like, well, if I got to go make 25 clicks, export to Excel, run a bunch of pivot tables, I still may not know the answer I'm looking for.
This is a big change, right, in the healthcare industry here. You're right. Like a lot of it was Excel, pivot tables, and who knows what other kind of formats that are out there. And you talk about effective intelligence. How do you translate that intelligence or that called almost like the real-time intelligence that you're getting out of the data into action? And I think a lot of that's determined by the people also, right? Like how do you ensure people are reacting and addressing and focusing on that to deliver change to their businesses?
Yeah. Again, Jeff, another great question. Look, I mean, if you have intelligence, but you're not giving it back to the individual that's driving the work in real time, you're not getting to where you need to be. So like in our world, like my people know, everyone who touches revenue cycle knows what their EIQ is, right? They understand they're effective and they're actually recognized and rewarded for being effective at their job. And the ones that aren't effective either self-select out or they rise up. We get them training, we get them the other skills that they need. And so it's really making sure that you bring that information back to the people that are running the revenue cycle, not running and managing. Those folks have to have intelligence too, right? Where am I leaving money on the table? But the staff person, the charge entry coder, the payment poster, the AR rep, the front office pre-registrar, pre-certs, patient liability collections, right? All those people are doing a function, but they need to know if they're effective. And if they are effective, you need to retain them and you need to reward them. Because the last thing you want in this day and age where it's hard to find people is to lose your effective folks. And I bet majority of the listeners out there, they don't even know who they may have subjective feelings about effective. Well, Bob's pretty good. Is he though? Is he? He takes 1.7 times more actions to get the positive financial outcome than Sally, who takes 1.2. What does Sally do different than, right? And so bringing that information back to the each individual staff person and building incentive programs is really, really important in revenue cycle. And these are not crazy concepts. I mean, I've been thinking about these concepts for 20 years. It's just grabbing the structured data necessary 20 years ago was a lot more difficult than it is today, right? So we have a lot more access to data, which can drive this intelligence, more importantly, the effectiveness algorithm.
Got it. And if you're just tuning in, you're listening to Payment Matters. I'm joined by Matt Seefeld of MedEvolve, and we're discussing revenue cycle efficiency in healthcare. And Matt, I wanted to highlight one of the things that you said before, which is like those high performers, retaining them, ensuring that they're delivering and they're doing a good job. But I think you alluded to this earlier. Staffing challenges are tough in healthcare and across the entire industry. Getting the right people in jobs, improving retention here. There's a lot of shifting sands right now across the industry. How should you address that? What are the things to focus on to ensure retention of key employees?
Right. Well, look, I mean, you nailed it. Every industry out there is suffering, from your coffee shop to your business office revenue cycle, right? You have people that are changing jobs. They've found new ways of living. You also have people who are going to be jumping job to job. They're demanding more money, right? It's everywhere. Every client I go to, I was just in Michigan this week meeting with a potential large orthopedic group. 35% turnover is what's experienced right now. So now you have think of just the operational challenges of that, having to recruit, hire, train, then they leave, then you got to recruit, hire, train, right? It's madness. So the key is making sure that you understand who your effective people are today and do what you have to do to retain them, right? That's the key. The work. Can you imagine if a bunch of your effective folks decide to walk out the door and you don't know that they were your most effective folks? I mean, that's a dangerous game to play, because now your net revenues are at risk, right? What if you retain non-effective people, right? What about this whole hybrid of full work at home or partial work at home, right? Can you offer that? If you can't offer that, you're going to struggle with recruiting and retention. Everybody wants to work from home. Can you measure people, right? These are all things that a lot of your listeners are going through right now. But what does this all come back to? The structured data necessary to determine who's effective and who's not, and what areas of revenue cycle need to be looked at. It's structured data put in a way that drives intelligence around effectiveness, right? And I keep going back to that because that's what it's all about. It's not a subjective, emotional discussion anymore. We have to be objective, non-emotional when we talk to our individual representatives and when we look at our revenue cycle areas that need to be improved, right? And we do that through data. And we do that through intelligent data.
Work from home has been ever present here over the last, during this pandemic. What's your sense? Is this do you think this is a long-term thing that you'll see in healthcare in terms of work from home, or do you see this being a transitory thing that will get back to normal and get back into the office? Where do you see that headed?
Yeah, it's kind of like I used to fly every week, Jeff, for, I don't know, 18, 19 years, and then COVID hit and I didn't travel for a year. And I was like, what, is it ever going to go back to normal? Well, it's not, right? I'm never going to go back to traveling like I did, because we discovered as a society, we can do more from home. We can do more over Teams meetings or GoTo or Zoom or Ring Central, as you said this morning, but look, the bottom line is that yes, it is here to stay. If you can't support a work at home model, you're gonna really be challenged in running a revenue cycle, and maybe outsourcing is what you end up wanting to do. Is just remove that burden. But people expect it now, right? They have a lot of things going on in their lives. They want to be able to have flexibility in their day and their schedules, because that's what we got for 18 months with the first wave of this pandemic. I don't believe it's going away. I think it's only going to accelerate. And I think anyone that can't recruit and retain people in that model are going to be challenged. So it's just a different way now. It's life is different for all of us. I'm sure you've experienced it too in your personal life and professional. I don't need to get on a plane every week just because I think I have to be there, right? I really challenge myself and say, do I actually physically need to go there? Or is this something I can handle remotely and then still coach a baseball team or a soccer team, spend time with my family, exercise, eat better, and still be extremely effective at what I do?
For some of our listeners who are hearing this show, they're thinking, wow, workflow automation, intelligence, this sounds great. Identifying effective employees and what they're doing. And my sense for those people that are listening that have none of these tools, where should they start? Are there some quick wins? Are there some things that they should be doing in order to kind of help improve their business?
Yeah, absolutely. Look, I'm beating a dead horse here, Jeff, but really evaluating what level of access they have to their structured data that's being stored in their PM/EMR system and any other system that drives revenue cycle performance process, right? So I think that right out of the gate is really important. And if you don't have the access, that's your number one takeaway. Is you got to get access. I would highly recommend building a data warehouse. There's tons of companies out there that do it. We do it, And then it's looking at what workflow automation technology your current system has or doesn't have. And that's where the bolt-ons come in, right? Is that, there's companies like us that have had to invest millions of dollars in years now building workflow automation tech that can sit on top of any PM, right? It's not just mine. If you want mine, that's great. I got a good one. But, these things are out there and they can plug into data warehouses. And then same with the analytics side. So where's your structured data? Do you have access to it? And then do you have the automation tools and the analytic intelligence tools that are going to provide these outcomes that I'm talking about? So I think that's key. The other thing I always need to throw out is it's not just about technology, right? If you're not willing to look at your people and your processes today and how they will be realigned to maximize the use of technology, then don't invest in the technology. Just don't. Save the money, because it's not going to be effective for you. Too many times I see people buying tech because they saw these vendors at MGMA or HIMSS and they were promised a story, from a salesperson. Then they install it and a year later they're not using it. And it's not because the tech was bad, because they were never consulted internally on how to maximize the use of that technology by changing up people and process to align with the tech. That's a huge, huge thing. I won't even talk to a sales prospect unless they're willing to give me as much data as possible so I can understand where there's potential return on investment. And number two, whether they're open-minded enough to recognize they may have to change the way they do business to align with our tech to get the results that they're promised, which is margin, right? The big difference. And so I would say the two other things to just kind of call out if I were talking about quick wins is, one is you got to get control around this whole patient liability piece. I've done a lot of work with, Instamed, Mark, and team. We just did a webinar a few weeks ago. But the bottom line is, if you don't have ways to collect that patient debt prior to service and estimate the debt, and collect the deposit, right, you're already behind the eight ball. I can't tell you how many millions of dollars are coming in every single month that's already owed balances from our clients. It's like you stop treating people for free. You can't afford that. If you're in an emergency room, yeah, I get it. You're in urgent care, it's a little more difficult at times, but not like an ER. But if you're an independent physician practice and you're leaving money on the table, these are high deductible plans. They know that they owe the money. Be flexible in how you collect it. People may not have the $3,000 in January. So payment plans, discounts, things like that are important. But you've got to get the patient liability piece down. And then overall financial clearance. 52% of our front end of our first pass analysis come from front office mistakes. So when we're talking about effectiveness and measuring people, this is not a back office thing only. This is an entire revenue cycle. If someone is getting pre-certs and you're getting denials for pre-certs, they need to understand that you have that level of intelligence and that they need to change the ways they do, right? So financial clearance, demographics, right? If you don't have a good mobile text and email nowadays, how are you going to communicate, right? Nobody wants to pick up the phone anymore. I want to Venmo you for lunch. I want to order my toilet paper on Amazon. I want it here today, right? I mean, this whole world of immediate gratification and digitization is here to stay. Why are we not doing this in healthcare? That's crazy to me. And are you getting the data that will allow you to do that? I mean, we see some clients where you look at a valid phone numbers, there's like 75% valid phone numbers. Like, 10% valid email addresses. I'm like, come on, folks. It's not that hard. It's called registration. Do you know what I mean?
Yeah.
So I know I kind of bounced around there, but I think it's important that folks know that beyond measuring effectiveness, is there areas of the revenue cycle that I see systemic problems in that drive that net collection rate down, which is the patient debt side and inability to effectively clear patients prior to service financially.
No, that makes a lot of sense, Matt. And we hear that across the board, and it's putting that to action is important here. You also founded a company called My Life Link. Love to understand kind of what that is and how does My Life Link intersect with healthcare?
Yeah, absolutely. So I'm in recovery from alcohol. I've been sober for over 4 years. I just celebrated my 4th year a couple weeks ago. One of the big challenges that I saw in trying to get into recovery and sober was how you can find people out there that are like you beyond your addiction. What happens is addiction in this country and frankly the world it tries to be a one size fits all, and that's not the case anymore, right? You look at emotional addiction, behavioral addiction, and physical addiction, we're a hodgepodge of all of those things, right? And so, but how do I go find folks, right, that I can relate to? So, when I checked out of rehab 4 years ago, pretty much, not 4 years, yeah, but I asked a simple question. I said, is there anyone in San Diego, in North County, who's gone to this program who's sober? And the lady said, well, I don't know. This was a prestigious rehab, by the way. So I was like, I think you would know. Then I said, well, do you have any idea what hobbies they do? Do you have any idea what type of work they do? Could I surf with these people? Could I talk about being an entrepreneur with these people? Could I start to build life and learn from somebody who's recovered? And the answer was no. And so I said, how can I go onto a Match.com or an eHarmony or Cars.com and match with my ideal thing? But I can't go on to a app and find people in North County, San Diego, who like to surf, who are fathers, who are coaches, who are entrepreneurs, who are in healthcare, who have anxiety disorder, right? And that's where My Life Link came in. So it's free. It's an app. It's in the Google and the Apple stores. We have thousands of people all over the world engaging on it every single day. It's my passion project because it saved my life. And that's how I want to be of service to others, is to make sure that if you're out there, you're listening, and you're suffering right now from either emotional, physical, or maladaptive behavioral addiction, or a combination of all three, you're not alone. Come join us. Check us out. Come join us. You're going to find a great community. And of course, if anyone's listening, Jeff, and they know of folks within their family or their friends or their colleagues, refer them on. This world is not going to become less addicted. When obsession becomes normal, that's addiction. And it doesn't matter if you're a workaholic or you're addicted to social media, or you're addicted to anxiety or not feeling good enough, or you're addicted to opiates or alcohol. It's all the same, right? It takes away our ability to see the possibility of transforming our lives into something extraordinary, something that we're proud of. And that's what we're trying to do here at My Life Link.
People forget the word healthcare is all about the care. And clearly this is the care part of this. And you have, an amazing ability to see both the revenue cycle, the money side of the business, but also the healing and the care part. If you had a magic wish for healthcare, and there's no limits in terms of what this is, what would that be?
That's such a big question. I would love for the healthcare industry to understand the possibility of how efficient they could become with better intelligence on what their folks are doing. and what outcomes they're getting, you know. And it amazes me how healthcare is still such a transactional business. You know, people who are effective in your organization need to be recognized and rewarded, but you have to understand how you will determine the effectiveness. And I think that over 21 years now in this industry, the fact that I've had to develop 4 workflow management systems and intelligence solutions is crazy to me, to be honest, right? I would think that these legacy systems would start to figure this thing out, and they don't. You know, other industry verticals have. So I would hope that at the end of the day, if you have a lean, effective workforce and they're recognized and rewarded by being effective, your margin is going to naturally improve because you're going to collect what you're supposed to collect on time, and you're going to do it with as few people as possible. And that's what we're trying to strive for here. And I think the pandemic only accelerated the necessity to run healthcare like a true business. You know, these macro events are not going to change, right? Deductibles are only going to get higher. Insurance companies are only going to pay you less, right? And then you have things that are out of your control, like a virus that may shut your OR down for 2 weeks or 4 weeks. And then you have the consumerism side of it, where it's like, I know I need surgery, but I'm scared about the Delta variant or the Omicron variant, so I'm going to push it off, right? Or, you know what, I've lost my job, I'm not working, and I can't afford this huge deductible, right? So there's so many macro things going on that are in our control and out of our control, right? But the stuff that's in our control, in my opinion, is understanding labor effectiveness and how that drives revenue cycle results. And that's what we're solving here at MedEvolve, because we have to, right? I can't afford to lose margin in revenue cycle. That's what we use. That margin, Jeff, is what drives our R&D. It allows me to hire more data scientists and develop more algorithms, software development, and all those. So we're really our own incubator when it comes to these concepts.
Those are the payment matters we're tackling today. Thank you to my guest, Matt, really for joining me today. Where can our listeners learn more about you?
Yeah, well, certainly you can always hit me up on LinkedIn, Matt Seefeld. I do use LinkedIn quite a bit, so if you want to connect with me personally. In terms of MedEvolve, I mean, we have great resources on our website at medevolve.com, and then my liflinkapp.com for those of you that may want to learn more about the virtual recovery community app. That would be a great place to go, or search our favorite Apple or Google Play stores and come join us. So feel like we're pretty connected. I would go through all the rest of the social media, Jeff, but I don't even know what those are, so I'm kind of limited. I get told I'm supposed to do something called Twitter, but I'm like, I don't even know.
No, thanks, Matt. Thank you once again for joining us today, and thank you to all of you listeners for listening in. And remember that you can listen in to this episode weekdays at 4:30 a.m., 12:30 p.m., and 8:30 p.m. Eastern. You can also listen to this on Apple Podcasts and Google Play Music, or just say, Alexa, play Healthcare Now Radio. If you have a comment about the episode of the show, follow #PaymentMatters or connect with me on Twitter at Jeff Lin. You can learn more about the show at Healthcare Now Radio or at instamed.com. Until next time, I'm Jeff Lin.